Good afternoon, everybody. Today, we're going to get into a very vast topic. It's going to be screening about screening cervical cancer. So, why do we impress upon screening for cervical cancer? It's because it's one of the commonest cancers in women in the entire world today. So, but in India itself, it's the second most common cancer that affects women. So, when we talk about screening, it's going to be a simple procedure which we'll get into the details as we go. So, as um, and it's a very preventable cancer. That is the reason why we are going to talk about the screening per se. And when I talk about screening, it's going to be early screening, early diagnosis, and treatment. So this will in turn lead to prevention of the cervical cancer itself. And we are going to look into vaccination as well. So this cancer, that it's a sexually transmitted disease that is caused by the human papilloma virus. And the human papilloma virus, there are different types, more than 100 different types of HPVs that are present, of which they can be classified into the low risk and the high risk types. The low risk ones are the ones that usually cause benign lesions like warts in the genital region, the anal region, the skin, the oral areas. Whereas the high risk ones, especially type 16 and 18, are the ones that cause cervical cancer. So when we screen for cervical cancer, we're going to mainly be looking for these high risk type of cancers. And going on, but this apart, when we say that when a person is infected with the HPV infection, it does not always mean that all women will end up getting cervical cancer. Most of the time, especially in the younger age group, the infection tends to be very transient and it can get cleared on its own in a few months. So, but when we talk about screening, when when the person gets an infection and for the disease to manifest itself, the lag period between the infection and for the disease to present, it's very long. It's more than 10 to 20 years. So when a person gets screened regularly, when the screening starts early and at regular frequent intervals, the disease can be picked up at an early stage. And when the disease is picked up, it can be treated accordingly. And so, and the screening, as I told you, it's a very simple test. There's nothing to worry about. It's a test called a PAP test that is done frequently. It's easily available. It's affordable for all general population. So, but before we go into the test, I'm going to talk about some of the risk factors that might cause the infection to turn into the cervical cancer, or even people at risk for getting the infection. Some of the causes are when the person's immunity is reduced in immunosuppression, which can be many causes, or when the patient is a smoker and the patient has a prolonged use of oral contraceptive pills, their sexual activity. When they begin their sexual activity at an earlier or a younger age, or when they have multiple sexual partners, and their obstetric history, when they have more number of children or pregnancies, or when they have the first child at a very young age. These are some of the factors which can lead to the person getting a HPV infection, and in turn the infection to turn into a cancer. So, with the mean age for the person for the cervical cancer to present is around 35 to 65 years of age, the mean being in the 40s. This disease is bimodal, which means that there are two different age groups where the disease can present itself in the 30s and 40s, and again in the early 60s. So, why are we stressing on screening? When we pick up screening at an early age and we do it at frequent intervals, the disease as such is picked up at an early stage and it is treated. So the disease is divided, or it's staged in different ways. The earlier ones being easily treatable than the advanced stages. So what are the symptoms that some of you can recognize it? Initially, if it is just a HPV infection, or if it's the early stage disease, the patients are generally asymptomatic, which means that they do not have much symptoms. But one of the commoner symptoms that early disease can present with is abnormal uterine bleeding, which is bleeding other than your periods, which can be bleeding in between your periods or bleeding after you attain menopause around your 40s or 50 years of age, or bleeding that happens after you have sexual intercourse, which is postcoital bleeding. And some of the other advanced symptoms which can present themselves when the disease advances are it can be foul smelling or blood stained vaginal discharge. It can be very watery, it's just white discharge instead of bleeding, but which can be very cumbersome for some patients. Or they might develop pelvic pain when the nerves are involved. Or it can also patients can even present with swelling of both the legs and other characteristics of cancer. Or when the disease has spread to the bladder or the rectum, they can present with involuntary passage of urine or the feces. Okay, these are some of the symptoms that the patient will present with, but these symptoms are usually present when the disease has advanced. So, as I told you, when the disease is in the earlier stages, they're usually asymptomatic. So, picking up this disease in the early stage is why we advocate screening. So, they can be picked up and they can be treated accordingly. And so we'll go about to how you do a pap test. So basically the cervix is a lower part of the uterus that is seen through the vagina. So what is a pap test? When you come to an OPD or a gynec consultation, the cervix will be visualized through the vagina and a smear will be taken. So this is all that happens in a pap test. But you have to come a little prepared for a pap test. So what should you not do? So you do not get a pap test done during your periods. It's a big no. So if this can interfere with the results of the pap smear, and you do not do any vaginal douching, and you should not use any foams or gels or tampons before this test is done. And it is advisable if you can avoid having sexual intercourse for 48 hours before the test is done. All these might interfere with the report of the pap test. So we might ask you to come in for another pap test again. So save yourself the trouble of visiting your doctor again. Please do follow all these don'ts before you get a pap test done. And this is a very simple procedure that's normally done in the OPD during a gynec consultation. It is a very affordable test for the general population, and it's very accessible as well. And going on to how we screen, as I talked about, how you screen this test. Well, it starts at 25 years of age and it ends at 65 years of age. So the pap test as such is the simple procedure of where we take cells from your cervix and send them for testing. But the testing we do is two types. We either just do a smear or a cytology where we look for abnormal cells. And there's another test called the HPV DNA testing where we look for the virus itself. So what happens is when you don't have to worry that, oh, you'll have to go through two tests. It's just the same simple one test, but the sample that is obtained is tested in two different methods. So why are we starting the test at 25 years and not earlier? When the younger population generally have higher immunity and there are more chances that the infection is cleared on its own. So if we test them, we're just subjecting them to unnecessary invasive tests, and this will lead to over treatment of a patient. But as the patient grows older, their immunity will fall down and they have the risk of the virus HPV persisting in the body and then later on leading into cancer, which is why after 25 years we advocate screening. It will start at 25 and at periodic intervals the screening is done until 65 years of age. And why do I have a cutoff of 65? Because beyond that period, the risk of a person developing cervical cancer goes down to a very great extent. So, which is not required after 65 years of age. So, when you do, as I told you, the two different types of test. If when we are starting at 25 years of age, we do either the cytology or just look for the abnormal cells, or you can get a HPV DNA testing done. It's an either or when it's at 25 years. But when you go to 30 years, it is always advisable when you get both the tests done at the same time, because the sensitivity of the test will increase when both the tests are done at the same time. And how frequently do you get it done? When it is just a pap smear or cytology, it is done at an interval of 3 years. When it is a co-test or if it's just looking for the HPV, then it is better it is advisable to get it done once in every 5 years. And in any interval less than that is not required, provided all the samples turn out negative. And when do you stop these? And when your pap test consecutively over a period of 15 years test to be negative, then you can stop your testing at 65 years of age. But if there is any variations, the screening or the treatment will vary accordingly. Suppose say you have got a hysterectomy done for various reasons. If it is for a benign non-cancerous disease, say a fibroid, then you do not have to get a screening done after your hysterectomy. But if you've gotten a hysterectomy done for a say one of the lower grades of cervical cancer, then screening at 1 year after your surgery is mandatory, and after which, if it's negative, it can be stopped. And if you've gotten a hysterectomy done for a higher grade of this disease, then screening will vary accordingly again at 6 months and then 18 months, and we'll take it up as it comes. So the need or the test, the stress factor for this is that when you get screening done, when it starts at an early age, and if it's done at regular intervals, the disease is picked up at an early stage. When it's picked up at an early stage, the treatment modalities tend to be easier and accessible. And as the disease advances, it becomes more difficult to treat the disease. So when we pick up early diseases of HPV or cervical cancer, it is easier to treat, and the burden of the disease on the patient and family and in general over the society will become much less. And the other ways, this is about screening. Now I'm going to talk a little bit about another method where you get a vaccination done to prevent cervical cancer. See, vaccination is not 100% accurate or effective in preventing cervical cancer. It is about 85 to 95% effective in preventing it. The advantage in that is it will prevent other benign lesions like what So what you get, there are two types of vaccines, the bivalent and the quadrivalent. Bivalent protects you from the types 16 and 18, the high risk types which cause cancer. And the quadrivalent also has the other protection against the other types of HPVs, which will prevent from the regular benign lesions as well. So when do you take them? This is given to both kids and young adults between the ages of 9 to 26, to both boys and girls as well. See, these lesions, this infection is obtained by both males and females as well. It is obtained through sexual activity, and this HPV infection spreads by skin to skin contact. So when it's given to both boys and girls, it helps in preventing benign as well as the malignant lesions in both these kids. So when do you start it? You start it at 9 years of age, and this vaccine can be given till 26 years of age. So when the vaccine is given between 9 and 15 years of age, the vaccination is given at 2 doses. 2 doses are sufficient because the immune response in younger children is much higher. So they'll be more prepared or adequate enough that 2 doses are sufficient for them. The 2 doses are given 6 months apart. When you take the first dose, wait for 6 months and get the second dose done. Whereas if this vaccine is given after 15 years of age, 15 to 26 years of age, the patient will have to get 3 doses taken. The first dose will be given, and after that you wait for 1 month for the second dose, and after that you wait for 3 months for the third dose, and this should be sufficient. This vaccination will prevent, or it will protect the patient from acquiring will protect the patient for a period of 10 years. But this apart, it does not protect, or it does not indicate that after you've taken a vaccine that the patient might not acquire a HPV infection. There are chances that you can get a HPV infection because these vaccines prevent only certain types of the HPV virus. There are other different types of HPVs which can cause infection. So this vaccine does not prevent you from obtaining other infections, and it does not also 100% prevent the person from developing cervical cancer, but it does reduce the incidence of cervical cancer, right? But and this vaccine also does not prevent other forms of sexually transmitted diseases like chlamydia or syphilis. This will protect against only HPV infections. And so when we conclude it, it's safer to say that it's always easier to prevent the disease before you get it. So maintain some safe sexual practices. Make sure you get a screening done, and please do get a vaccination done, which is advisable. And this will reduce the burden of cervical cancer in the society. So this is the conclusion of it. So please avail the availability of cervical cancer, and which is widely available in screening. So please make use of it. Get yourself screened at regular intervals and prevent yourself or help yourself in in preventing cervical cancer. Thank you. And I'm Dr. Manasa, Associate. And I'm in the Department of Varam, MGM. Thank you.